All right, thank you so much, Jackie. We welcome in Dr. Cedrek McFadden, our 7 News medical expert. The race is on for a coronavirus vaccine, and the doctor's here to talk about it. So the question is, what makes a vaccine successful? What's going into this?
So a vaccine has to be successful. It has to be able to create the body's own immune system to create antibodies against the virus without causing disease itself. Now, most of these vaccines being produced are targeting something called the spike protein. This covers the virus itself, which allows that virus to attach to the person and then invade the cells. And so these antibodies attach themselves to those proteins, so therefore the virus doesn't work anymore. And so they use either, a weakened virus or either an activated virus to cause it to work, or actually now they're also using something called gene recombinant therapy, which is sort of a newer technology being incorporated now.
So does a vaccine change or have to change if the virus changes? I mean, can this virus mutate, and will the vaccine work if it does?
So all viruses mutate. Coronavirus is no exception. Viruses can make it very challenging for the vaccine makers because if they mutate quickly, if they change shape, or if they're no longer working for the strains coming along behind them. Fortunately for this coronavirus, it's mutating very slowly.
Good.
It's not creating this sort of mega virus that's not going to be responsive to any vaccine being produced by these trials.
All right, well, the big question always when we talk about the vaccine is, when will the vaccine be available? What's the best guesstimate now?
So it normally takes years, if not decades, to produce a virus. There are over 100 different researchers around the world working on this. Just today, a company, a biotech company out of the U.S. announced that it's starting human trials in Australia.
Wow.
And they're hoping to have some success, some emergency use vaccine by fall. We could be looking at a vaccine hopefully by the end of the year, if not the beginning of next year.
And how do we know the vaccine will be safe? How do we figure that out?
Lots of testing, lots of people involved in these trials. While a virus is being tested, it has to be sure that it doesn't do undue harm, that the side effects are minimal, and that it actually works, that it's creating these antibodies. If it's not safe, if it's producing unwarranted side effects, it's abandoned. It is abandoned almost immediately. So there's a lot of testing being done by that, and that's going to be one of the things that they're going to be looking at in the long term with this virus.
So once they get that safety piece in order, what happens?
So then we have to make sure, once we make sure it works, it's safe, then we have to make it. And it has to be made in large volumes. If you think most people in this world are going to be potentially carriers of this particular virus, and they actually think that you may need at least 2 doses of this vaccine for it to work. So that's billions of doses you're going to have to make. So that's a lot of production that has to happen. And then you have to have the needles, you're going to have the syringes, you're going to have the vials, you're going to have the personnel. So a lot of different moving parts to make this vaccine work and actually make it work.
It's interesting. This is the first time I've been hearing about the 2-dose thing. So how does that work? 2 doses, how far apart? Do they even know?
Well, so it happens now with children. There's some vaccines you have to get sort of a first part, then you come back a little bit and get another. It just gets the antibodies to that proper location to give you that immunity that you need to affect it.
Interesting. Dr. Cedrek McFadden, we appreciate it. Of course, he's back live at 5 today to take your questions. You can go to the 7 News Facebook page right now, add your questions to the list, and we'll tackle those at 5. You're watching Carolina's Family at 4. We're coming right back.